As our guest in studio is a voice you know quite well and a face you are very familiar with. Because when she left radio, she went into politics. Not one who has a lot of presence everywhere. Good morning once again.
Good morning, Sana. How are you?
I am fine.
I'm happy to be here, as I said earlier.
Mm,
And I've just been thinking.
mm.
I didn't leave politics and go, leave radio and go into politics.
Okay.
When I was on radio, at some point, I was still in politics and
You were-
doing radio at the same time.
oh, you were doing
Yes.
both? Yes. Okay.
Yes.
Okay. I think I
Yes.
should know.
Yeah.
I should
So
know that.
I went to contest the Wajabawe seat.
Mhm.
I lost. I came back
Mm.
to do the work.
You came back to do radio, then you
Yes,
left.
I came back. Then
Yeah.
eventually I was appointed deputy chief executive for the Ghana Free Zone Sports.
Yes.
And that's when I left.
Yes. I recall the last time, before the 2024 elections, there were wide calls for you to return to Ejagbawe.
Yeah.
Was there pressure on you?
You know, when I lost the second election, you know, I'd gone twice.
Okay, yes.
I had told myself that, in fact, they have lost me. I didn't lose the election because I know what I would have done in the
Yes.
constituency if I had won, and I know the toll it would have had on me.
Okay.
So I simply told myself that it wasn't something that I was going to do again. And I can tell you for a fact that at that point there were so many people in high places who had called me and given me the exact reason why I should go back. Professor Mills had won a third time, and how third time lucky, and all that, and all the reasons that.
So it wasn't only
were-
the constituents.
No. All over the place, from our own party, everything. But if you have known me for a while, when I make up my mind, it's difficult to change my mind. I had made up my mind. I had moved out of the constituency. I used to live there, and
Yeah.
you know that I lived there for so many years. But I made up my mind, and I knew that what will cement that decision was to move out of the constituency. So I actually moved, but I still have my vote there. I help them every now and then. I would do anything for Wajabawe, but to contest for elections, I don't know.
Because I remember in your second contest, I was surprised at the level to which you went. Even before you became MP, you were a parliamentary candidate. The things you did.
Yeah.
So everybody was surprised when the election results were
Exactly.
announced and you did not win.
And I even did better in my first try than the second one.
Okay.
So clearly, I knew that there was a problem. Yes.
I see. But why is Weja so important to you, Wejagbawe?
I don't know. It was just close to my heart, and I thought that there were people that I could help. I could make interventions on their behalf and then change the constituency. But I'm sure they had other plans. I hope that plans have served them right.
Is that the end to your parliamentary dreams?
I think so. I think so.
We won't see you on the ticket.
You know, I'm one that
contesting
cannot be boxed in one corner. One that cannot be boxed in one corner. So clearly, I simply think that when I'm an all-rounder, like the last elections, I spent a lot of time in the Ashanti region. I had gone into other regions working and all. So that is me. That's the kind of spirit I have. It's not one that has to be sitting in one place. So I simply thought that maybe the Lord was just directing me that, listen, you don't have to be an MP, you have to be an all-rounder. And I think I do that well. And that's what I want to do. Every now and then, be all over the place, working from one constituency to the other, solving one problem or the other. I feel good about it. And I think my heart sits well when I go around the country instead of sitting in one constituency and working in one constituency. So that's me. I think that for now, I don't have any plans of contesting any parliamentary seat. So those who are sitting on the edge, please sit well. I'm not coming.
And it is that passionate approach to everything, because when I came in here, you were here, you were far senior to me. So I realized that you were always passionate about everything you did. You either wanted to do it fully or you wouldn't even attempt it at all. So when I saw you had been given the job of heading the Ghana Medical Trust Fund, I was like, oh, perhaps you may be the best person to do this job at this time. I wonder what you met when he handed you the letter, exactly what were you supposed to do? Because it didn't exist. So what was the mandate that they had given you?
And I simply walked into that office, picked up that green letter, and I'm telling you that for the first time in so many months, I slept very well.
Really?
Yes.
They were giving you...
That letter was healing to my soul.
Why? Explain.
I'm not explaining, but I thought that when I received that letter and I knew I wasn't going back to my office the next day, I think that it was healing. I think that it opened a certain door for me. For those of you who have known me and how passionate I am about people not doing well, people simply who are in need of help, those who are sick, need help to go to the hospital and all. This was my passion. So I was a very happy girl when I got that green letter. Even though I didn't have an office, there was nothing that I was walking to the next day. I was a very, very happy girl. I went, slept, and I woke up at 7 a.m. for the first time in so many months. So
But you had to start from nothing.
Yes. But then knowing me, it didn't take too much time. This letter came on the 31st of July. The next day was the 1st of August. Then the appointment took effect from the 1st of August.
Okay.
And by September, we had a secretariat. I had about 5 people I'm working with already. We are planning on what to do, what our next move is. We decided that, listen, we are not going to sit in this office. We're going to go on a needs assessment tour because we were so sure that our mandate was going to deal with the tertiary institutions, like the tertiary hospitals, I mean. So the regional hospitals, the teaching hospitals. So it was clear that these are the guys that we're going to work with. Let's go and see exactly what they have, what they do not have, what the gaps are, and everything. So between me, Dr. Nobe Kipo, who's my policy advisor, he is a doctor, so at least he understands the technical bit of what we had to do, and a few others, we just moved. And then we went to 10 regional hospitals and 5 teaching hospitals. And I'm telling you that has become our Bible from then up till now, because clearly it showed us what we were supposed to do, the interventions, the gaps, the data, everything. And if there's any decision that we took in those early days of the Ghana Medical Trust Fund, is the decision that we took to step out there. And let me give a lot of credit to my Honorable Minister of Health, the Kabna Minta Akando. Fantastic guy. He simply came and said that, listen, you're going to do this job and I'm going to be there every step on the way. Grab it. Let's run with it. And then he brought this idea of going around and checking. And then we stepped out there. And I'm telling you, you can simply not sit in Accra and think that because there's Kolebu, there's Ridge Hospital, and also there are hospitals in Accra or there are hospitals in Ghana. Some of the hospitals, you simply finish the tour, you sit in your car, and you lose your appetite. You are thinking that, wow.
After just going through the facility.
Exactly. I remember one of the days we had gone to Efia Konta Hospital in the Western region. And I'm thinking that, wow. And this is the Western region. No ICU. They had made a makeshift ICU. They were virtually using a laundry and put some beds there, a few ventilators, and that's what. Yes.
ICU.
Because the past government had virtually broken like 60% of that facility to build new ones.
Okay.
So virtually what they had to work with was like 40% of their facility. And it just simply was scary.
And what you saw, that was supposed to be a regional hospital.
That is a regional hospital. And because of these Galamsey issues and all the issues in that part of the country. Can you imagine what sort of cases are coming into that facility? And they had very little to work with. And I sat in my car and I'm like, wow, God, give us the strength. Because what I saw clearly made me think that, do we really know what's going on in our hospitals? And then when it comes to these facilities, it doesn't really look at your political colors, who's NDC, who's MPP, who's CPP. Doesn't work. What works is that when you are in dire need of help, where would you be taken to? When that accident happens, where will you be carried to? And that's not what we were thinking about. Virtually, we live our whole lives in this country. Political animals. It's you, it's me, it's that, it's green and white, it's blue and white, and that's it. Maybe we should turn our heads and see what our medical facilities are going through. Exit Efia Kwanta, enter Ridge Hospital. And that is our capital city's regional hospital. And you're thinking, this is Accra.
Even from Efia Kwanta to Accra did not give you hope.
This is Accra. And Ridge Hospital will not give you any hope.
Really?
Yes. And I'm thinking that if you go by the data that the hospital is giving you, 800 people walking into that facility, and then plus about 200 going on admission daily, you are talking about 1,000 people walking into that facility daily. I didn't say weekly, I said daily. And Ridge Hospital cannot boast of a mammogram machine. And you and I know that in October every single year, corporate institutions, everywhere you pass, the whole country is draped in pink, celebrating Breast Cancer Month. And I'm thinking that any young lady who decides that I've hit 40, let me just go and check what's happening to my breast, can simply not even walk into the Ridge Hospital because they do not have that equipment there.
Ridge
Hospital.
After all the work that was done there.
No mammogram machine, no CT scan, no MRI, no fluoroscopy, X-ray machines.
Nothing.
That is a Ridge Hospital. So can you imagine what's happening in the other parts of the country? And I'm saying that Greater Accra, how many corporate institutions don't we have here? But who is going to tell the story for who to go and make the intervention? So it helped us. And that's why I simply think that the needs assessment was a game changer for us as we try to build the foundation for the Ghana Medical Trust Fund. It showed us exactly what we were supposed to be doing so far as our work was concerned.
And I think that's it, because you're talking about the lack of basic diagnosis.
Yes. And
you need all that.
Yes, and for the Ghana Medical Trust Fund, you're talking about chronic diseases. If I can quote directly from the Act, it says that the object of the fund is to mobilize resources to finance and support the provision of specialized medical care for the treatment of persons with chronic diseases. If you have listened to the president quite often, especially when he talks about the healthcare of this country, he talks about the pyramid.
Yes.
And he talks about how he wants to introduce a primary health care. And the free primary health care is at the base.
Yeah.
That's when you can simply wake up in the morning, you have a headache, you can walk into that facility, get your pressure taken, test your blood, and see if there's anything wrong with you. And that's free. You understand me? Yeah. So the moment that you are diagnosed with something that is higher than what the free primary health care offers, you go to the next step of the National Health Insurance. National Health Insurance has been there for over 20 years. It's worked perfectly and it's even better now because the claims are paid early.
Yes.
And clearly you're not getting a lot of issues so far as the national health insurance is concerned now.
Yes, not over the last 1 year.
Exactly. So the moment that you get to that level of the national health insurance, where the national health insurance has ended, even when it comes to breast cancer, at some point the national health insurance will not cover. It comes to all the other, even prostate is not on the national health insurance. So then it ends there. So the president, in his wisdom, and the team that he worked with, thought that, listen, there should be something you can take advantage of when national health insurance ends. So we say that where the national health insurance ends, the Ghana Medical Trust Fund begins. So we are on top of that pyramid. And that's taking care of chronic disease. You and I know that in this country, as of now, about 45% of deaths are due to NCDs, non-communicable diseases.
So we're getting close to 50%.
Exactly. And you know what it is: cardiovascular diseases, stroke, diabetes, kidney failures, cancers. Should I add more? So the president simply thinks that, listen, the moment you are hit with a family member, or even if it's you who has an NCD, clearly it goes beyond 50,000 plus to get yourself to go through that treatment. And then even as you go through that treatment, no matter how rich you are, I'm telling you, at a certain point,
you need help.
You need help.
Yeah.
So that's how come the Ghana Medical Trust Fund came into fusion. And I am thinking that if the president does not have that kind of wisdom, who would have thought about even a 3-tier health system? Oh, Ghana Health, the health insurance is helping you to a certain level.
Yeah.
When they are done,
you
go
manage
and
yourself.
die or find help somewhere else. So I think that the Ghana Medical Trust Fund is a game changer. But there are some people who simply thought that the moment that it was announced, they said that Obuobia was the administrator. We have to take the money and start paying medical bills. It doesn't work like that. Because at the end of the day, these tertiary facilities that you work with, there needs to be a software that will be connected across these facilities. So that when the medical director, who's supposed to make the intervention on your behalf, because the patient cannot apply on his or her own, it's the doctor who is treating you. It's the one who is supposed to make that intervention on your behalf.
Oh, so a patient cannot stand up, write a letter and say, help me.
No, you cannot even walk into our office and say that, listen, I think that you need to put me on this fund. It's not possible. It's the medical doctor that takes care of you who is supposed to make the intervention on your behalf.
So why wouldn't we take it one at a time? So here you are, you've set up a secretariat. By this time, you've done the needs assessment. And I want to find out, the needs assessment, after you found out that they don't have mammogram, they don't have all these things, what are you in the position to do to help?
The last time somebody said that, listen, all the money that is given to the Ghana Medical Trust Fund, they are supposed to be paying our medical bills with. And we are not supposed to be doing any other intervention with that money. But then what we are supposed to do is beyond paying just medical bills. Our core mandate, first of all, is paying those medical bills that you know of. Secondly, we are training the specialists that are supposed to be taking care of these patients living with the non-communicable diseases. So the specialist doctors, specialist nurses, pharmacists, and healthcare providers. We are supposed to be training a number of them so that they will be in charge of taking care of these persons living with a non-communicable disease. It doesn't just end there. we also are supposed to invest in research.
Okay.
Research into non-communicable diseases. So that when you wake up, you say that in the OT region, there's this particular cancer cases that keeps coming from this side of the country. Let's send these researchers there. Let them find out exactly what are the causes of this particular cancer.
So you could go into prevention, help working on prevention, education and all. Okay.
We are not supposed to be working on prevention.
Okay.
But then our research can be used by these free primary healthcare people because they work on prevention.
Okay.
Yes, but then we are supposed to invest in the research that can be used to identify exactly where we are why NCDs are on the rise, what can be done, what are the various interventions that can be made. Okay. So I have spoken about 3 already.
Okay.
And then the 4th one that everybody keeps asking, and I have heard members of parliament who even pass this act ask about it. Why are we investing in infrastructure and equipment? Senna, when you wake up today and there's no equipment to diagnose whether you have cancer, how are you going to get the treatment? And how is the Ghana Medical Trust Fund going to pay for it? So you need those equipments in these various tertiary hospitals and beyond that can virtually diagnose if you have a cancer, if you have a stroke, whatever it is that you are showing signs of. So equipment is very, very important to what we're doing. And sometimes you have the equipment, but you don't have the infrastructure to mount them.
Okay.
How are you going to do that? So I'm saying that even before we roll out, we need to identify the equipment that will be used to diagnose these patients that we're going to pay the medical bills for.
Okay.
So if you wake up and think that what is Ghana Medical Trust Fund's business in investing in infrastructure, equipment, all they have to do is the 2.3 million that has been approved by Parliament, moving straight, pay medical bills.
You must be sure that they are getting the diagnosis right.
Of course, but even if they don't have the diagnosis, how would you know what you have to pay for?
Yeah.
So the moment that you start getting into a conversation where everybody is asking why you need to invest in research, why you are investing in medical equipment, why you're investing in infrastructure and all, this is the explanation we need to give to people who simply do not understand exactly what the mandate is about. The mandate is not about paying medical bills alone.
Okay.
In fact, if these equipment and infrastructure and all that do not come in, we'll just keep paying the medical bills and paying for what? Because they will not be diagnosed. So all the load is on Kolebu as of now, because Kolebu has a fair amount of equipment that are working.
Okay. So they do most of the diagnosis.
Exactly. And the local Kolebu is doing about 2,000 patients almost every single day.
2,000?
Yes. So if you retool a facility like Ridge Hospital, what you're doing is that you're taking a lot of the load off Kolebu.
Okay.
So that Kolebu can have some space to deal with their patients also.
Okay.
And in picking up the facilities that we will work with, we simply cannot even just work with Kolebu and Ridge. Okay. So if you have been monitoring our social media handles, what we have done is that we've started meetings with some of these quasi and private facilities.
Okay.
And I'm sure that very soon we'll go into some of the cases. There are cases that are sent to Kolebu, and Kolebu will tell us that they can simply not work on this. Can we refer? And Kolebu is referring. Our last case for the midwife was referred from Kolebu to Urake. Because Kolebu had catheterization lab.
Okay.
And if you know the catheterization lab, you don't have to open people's heads as you don't have to do an open surgery. So what they do is that they just go through the veins and then get to that point. And then I'm sure that one, the doctors would explain it to you. But what I'm saying is that the moment you have the catheterization lab, you don't need to do an open surgery. Kolebu had the cath lab, but somehow it caught fire and then it's not working for some months now. So if Kolebu has such a delicate case, it has to refer. And that is your biggest teaching hospital. So Kolebu is even referring to some of these private institutions. So we do not have a choice. We need to work with some of these private institutions because some of the cases will have to go to them. There are most of the cases that maybe Kolebu or even Rich cannot deal with. We need to refer them. So we had a meeting with Uracare, Bank Hospital, UGMC, and I think a few others. We have about 6 of them. So when we are done with the software, we will onboard these facilities. So we work with them. So we know that this patient is going to Kolebu. The other one is going to Bank Hospital. The other one is here. But because they are all connected to the software, automatically when the medical facilities make that intervention, it comes to us. And then we have 14 days to vet it and all. So I'm saying that you cannot take that mandate and immediately decide that you are paying medical bills for patients because they need it. Or if the software is not there, you can simply not do it. Now, what we did also to test what we are about to roll out is to do the 50 pilot cases.
50 pilot cases.
Yes.
Okay.
So that's
explain that. Exactly what did you do under the 50 pilot cases?
So what we want to do is to do like surgeries, very difficult cases and all. 50 patients. Just to understand what we'll be confronted with when we roll out. So we started the 50 pilot cases. And I think that so far we've done about 34 cases.
34 out of the 50?
50.
How did you pick these people?
We gave it to the medical directors and because we wanted every region to
be a part of
it. So the medical directors in the various facilities make the interventions for the patients.
So they choose the patients that they wanted you to?
The patients that they think need the help. There are some who can afford it. There are some who simply cannot afford it. But what we did was that we had a meeting with them and told them that we wanted to start our pilot cases and we needed them to make the intervention for some of these patients.
50 of them?
50 of
in
them.
total?
Yes. And then so far we've done 31 patients out of the 50 cases ahead of the April rollout because those pilot cases will help us to know exactly what we're going to deal with. And between the 31 patients, we have from 5-month-old babies to 70-year-old
5-month-old
adults. Yes.
As young as 5?
As young as that. We have done 12 males, 19 females. And then the beneficiaries so far are from 11 out of the 16 regions. Yes. And between you and I and our listeners, those 31 cases alone cost the Ghana Medical Trust Fund 2.5 million Ghana cedis. It should give you an idea.
2.5 million?
Yes, for the
on
31 cases. Yes.
What are you doing? Treatment or management?
Surgeries, chemotherapies, deep-seated tumors. For if you go to the cardio thoracic center in Kolebu, we have paid for about 9 whole in heart cases, and these patients are going to go through surgery. When you go to the neurosurgical department, we've had some cases there also. So there are different types of cases we're dealing with, but basically we're dealing with more of surgeries and interventions that could ordinarily have just killed that patient. And so far, I think that we haven't had any deaths so far.
Okay.
And all the 31, apart from the ones who are yet to go through surgery,
Okay.
all of them are in good standing. And it's an intervention that ordinarily they could not have afforded, but because of the Ghana Medical Trust Fund, we made the intervention and they are doing well.
Well, if you just join us, she's the administrator of the Ghana Medical Trust Fund. And as usual, one of the things you learn from working with her is the cautious, deliberate, one at a time approach. Because sometimes when you write stories, so you look at the stories and say, what is this word? So always cautious, must take her time, understand what it is before going into it. So as we speak now, you haven't done a full rollout yet.
No. We intend to roll out on the 1st of April.
1st of April?
Yes, please. So we are done with the 50 pilot cases by the end of February. The software issues are ongoing. We are hoping that we can go through procurement and then get it set up by the end of March. And then from the 1st of April, we can go live.
I see. Well, we need to take a break. When we come back, we'll delve more into some of this because there are many people who have many questions to ask. So to those of you who are saying that you've been trying to, we haven't started work yet, like a full rollout yet. So we'll come back and ask a few more questions on some of the issues you're raising, and then she'll give the responses accordingly. We'll take a break. We'll be back.
Thank you.
Are you ready to revolutionize the future of agriculture? The Ministry of Trade, Agribusiness and Industry, in partnership with the Ghana Exim Bank, proudly presents the Ghana Agrotech Fair 2026. The fair will feature exhibitions, market linkages, masterclasses, and workshops on climate-smart farming, digital tools, and export development. Join us at the Black Star Square from March 17 to March 19 at 9 a.m. each day. The President of the Republic, His Excellency John Dramani Mahama, will be assisted by the Minister for Trade, Agribusiness and Industry, the Honorable Elizabeth Ofusue-Jari, and the Chief Executive of the Ghana Exim Bank, Honorable Sylvester Adina Mensah, to open the fair. Government agencies, agrotech firms, startups, farmers, financial institutions, and the general public are all welcome. To exhibit or for inquiries, call 0559 679326 or 0242 585419. Media partners: Daily Graphic, Media General, Radio Gold, City FM, and Channel 1 TV. Ghana Agrotech Fair 2026, transforming agribusiness through local innovation and technology.
Yeah, Mama Bro.
Wanya?
Your friend Mama na me dey sign. Sound dey ose wunya hu edro. Enemre mu a PC Herbal Center. Ede mfidie ehwehwe nipadua mu. Na odi ahahanra FDA agye atum esa yare esiesie wi. Why and ose ne mpaso agro enso ani. Munyina monko PC Herbal Center. Na ma menzema besiesie o. Wusisi ya hye catheter eni yare be na tete wo. Ko PC Herbal sesia bema ana oba onwo ana wode upenimnyam ana etunyam nyina bra na PC Herbal be hihye wo nipadua no ama na sisi so kama ne bo so de se fofofo.
Hey sir,
she PC Herbal Center itrakwan ewo Madina Social Welfare Sakraden so on the Air Force Station Basic School no and a din hwenimu 0540 740 740 0542 995 997 oba bema bra PC Herbal Center. Na yen shell.
I've been so cool. Wa Mebel Restaurant and 2 a.m. sounds. Now face the Mebel's Pub. Wa Nungwala Tade Saint. Wa Nautica Quantum Poniso. Enti Jumedie Bia Wudi Obehia Ghana Nuane. And in Nigeria for Nuani P. Etis jollof rice, plain rice, bankuni tilapia, mabrami pizza, eba any agushi, inkuobi, okra soup, bitter leaf stew, any afofro bebre. So we a year oji our dear wotu ubedin. Anampo se wudi Jumedie na huhia in Nuane Papa no. Pomo dinner for any Mebel Restaurant, any Mebel's Pub. Yeah, free delivery. Hwehwɛ mo akyira kwan ɛwɔ Nungua C5 Junction ɛne Nungua Latter-day Saint. Frɛ ɔmo ɛwɔ 0244 052012 anaasɛ 0270 258028. Mahama'S Restaurant ɛne Mahama'S Pub. Enuane pa nyinaa hemfie.
Hisense, si Honko, Yike Amerisia de Nyana, Nyapa electronic news as a hahia, abe television, refrigerator, chest freezer, air conditioners, Nenyabe, laser television, gas cooker, washing machine, smartphone, sound system, iron, air fryer, bubu lemiasia, abe electronics news as a wope ganto automotor kale Ghana, Nyapa John lete, eye, wo vakple, epe atom manufacturer defect warranty son. Hisense showroom, le Ghana godo, tokunyebe na geremiaji, le gen, pletema, kumasi leme, takradi, Takwa, Mankesim, Obuasi, Sunyani, Techiman, Tamali, Kwakwe, Koforudia, Nena Premier Pa Jono, La Sinueji, Hisense, Afi nu adojeole, Afi vichoro nuole, Afi electricity nuza sameno na jofuole, Afi nuo dile, Afi nuole achiamele, Afi ke egbenkubu nuo bode santo, Nena nu gome kokodia, Tokonyem na yo 0302 550 000. Alo na gere pa website www.hisense.com.gh. Kena nyenyorebe, mile Facebook play Instagram, Twitter YouTube ta yi na Jemia Yome La Muganu Toma mi le Hohwe Alabato Junction mi tere Green Shield Agro Hisense everyday prices for everyday people.
Anokwa semankopie enidaso wo herbal clinica enke ni yade aka me so ye ka herbal clinica bobbin eni yade mu pa dia na edi kan ene enidaso wo herbal clinic adokotafo animdefo a posua dia ben wonya brehwehwe ni yade potia eha wo na wo san yade no krakra se ye wani na taprunsuo eso na keka wo eso ye wu wisi ade wachira wonhunu wontumi nhunu atwedie yempo na wakenkan ne mentonchia na enidaso wo nti mese pania to foma na jompo a ubehuna fa efri se eni yade de wote no te yade binom so te se stroke hernia ne diabetes de wobetu asia kra efri ni pedua no mu afi lab test ahodo no nyina so woye bi
ya wa kra Kumasi takra den so ubehu yen wo Port Quarters a eben Archbishop Porter Girls School
Fred Doctor e wo 0559 901234 eni da so wo herbal clinic na eni da so wo ma obia.
Been told the station is gold, never gets cold, so just be bold, advertise, cause here you sell out.
Well, two things before we continue. The first one, when factories rise, we protect them. When businesses grow, we guard their future. When families invest in what matters most, we secure their dreams. Over 60 years, SIC Insurance has been Ghana's shield, built on integrity, reliability, and care. From motor to fire, accident to travel, marine, and more. Whatever you value, insure it with confidence, insure it with care, insure it with SIC Insurance. Because at the heart of every policy is a sacred promise to care, to deliver, to be there when it matters most. Call 0800 100 055 or talk to a broker or licensed agent today. SIC Insurance, our promises are sacred. And a reminder from the management of the National Lottery Authority. They want me to tell you not to indulge fraudsters who send messages on Facebook, WhatsApp, other social media platforms in the name of the NLA and impersonate NLA officials promising leaked winning lotto numbers in exchange for a fee. If you are chatting with one of them, NLA says I should tell you that they do not give out leaked winning numbers. And as well, ask anyone, a group of people to register people for a fee in exchange for lotto numbers. Their games are purely games of chance, so just play and win. NLA will not be held liable for any losses arising from indulging these fraudsters. Stay alert, don't be scammed, and play responsibly. For further inquiries, contact NLA's customer service helplines on 0266 087 966 or 0266 087 946. NLA, development through games. Well, we have in the studio the administrator of the Ghana Medical Trust Fund, and her job has been to set up not only the physical, not where she stays, so she has to be now connected to the hospitals one after the other. And I guess that's why you're getting the software.
Yes.
So the software is to help you connect with every hospital.
Yes.
Provides a communication mechanism to
between the medical director, the doctors, and us, the secretariat, so that they can make the interventions on behalf of the patients.
And then you had to put in place a regulatory regime, so a law. So this law, was it written within the time that you were?
No. But the act was passed before an administrator was
before
appointed.
you were appointed.
Yes.
Okay, so when you came in, you had a law on your table telling you what you do, what you can do, what you're supposed to do, and what you cannot do.
It even tells you your sources of funding and everything. So it will tell you that you have 20% of the total monies allocated to the National Health Insurance, and then monies approved by Parliament, monies that accrue to the fund from investment. So when you get your money from the National Health Insurance and it's not in use at that particular moment, you can invest it. Also, we can get grants, donations, gifts, and other voluntary contributions made to the fund, and I'm sure that's why we keep asking people, to, corporate institutions and all individuals and all, to come to our aid, because every single CD matters. Indeed, we need your money to help. Many people simply says, "Hey, and I laugh." Yes, 31 cases cost us 2.5 million, you see. So people should really understand that the mandate is a broad one and it's a bold decision. So at the end of the day, it's not going to be a walk in the park. We need to take it and run with it, because at the end of the day, lives will be saved.
So let's go to the sources of funding again. You are taking 20% from
the national allocated monies allocated to the National Health Insurance. And then monies approved by Parliament.
Okay, so you have a parliamentary. Is that what we saw recently?
Yes, recently that was approved. The National Health Insurance allocation will simply go to Parliament for approval.
Okay.
So that's what you saw recently, and everybody says
that's 20%.
The money is big. Yes, that's 20% of national. Yes.
And then what else can you?
Grants, donations, gifts, and other voluntary contributions made to the fund. And then any other money or property that may become lawfully payable or vested in the board of trustees of the fund.
So what you're getting from National Health Insurance Scheme approved by Parliament, 20%. The expectation is that you raise the rest of the 80% from grants, donations
and all.
Hey.
So whilst you're looking after your patients, you're also going with a cup in hand to corporate institutions, individuals, and all, finding money, because what you have for the 20% will not be enough for the treatment, for the research, for the equipment and infrastructure, and for the training of the specialists.
I see.
Yes, I am hoping that eventually government will give a direct source of funding to the Ghana Medical Trust Fund. I know that as we build the foundation and it becomes clearer, government will make that decision. But for now,
so aside the 20%, you are expecting that some really significant allocation from government should come?
No, what I'm saying is that maybe when we get a direct source of funding, the National Health Insurance has a direct source of funding. Yes, but for this one, because of how we are starting, I think that eventually government will make that decision. But for now, we will depend on what the National Health Insurance gives us and what we can solicit from corporate institutions and individuals who really want to come and help.
Clearly that is.
Yes.
That's inadequate, because if you're telling me 31, you just have 31.
Yes, and that's about 2.5 million.
2.5 million. So even the 2.7 billion that people are shouting over.
All over the place. And people keep sending you the artworks that the media houses put out there. The money is big.
I can imagine. But after getting 2.7 billion, and I saw Treudo.
Yes.
That you were doing.
But let me tell you, individual donations and corporate institutions who came through for us last year, we got between September and December, we got 6.6 million.
6.6 million?
when I went with a cup in hand.
Oh, you did?
Yes, Gold Board alone gave us 2 million Ghana cedis.
Okay.
Ghana Gas gave us about 300,000.
Okay.
A lot of them, the banks, First Atlantic Bank gave us 200, Omni gave us 300,
Okay.
Universal Merchant Bank gave us 200. And all these individuals, there's a gentleman who one day called me, I think his staff called me and said, my boss wants to donate. And I'm like, really? He says, yes. So we gave them the account number and everything. They paid in, sent the slip. And then this gentleman had donated 100,000 Ghana cedis to us.
Oh.
Yes, there are CEOs and MDs of institutions who are donating their monthly salaries to us. I'm not sure they want me to mention their names and all. So many people simply know what health is about and how, say, in saving a life, you would have made a lot of impact. And in their own quiet ways, they donate to us. The Cherudo we are doing for the month of February is basically taking these boxes out there and announcing star 255 hash.
Star 255
Momo numbers, yes, for individuals. And I'm telling you, the 1 CD, 5 CD, 10 CDs that keeps coming in, it's just individuals who simply think that they just want to be part of this, they want to help. So for this month of February, that's what we are doing. In every little way that we can find some money to add to what we have so that we can continue to touch lives, we will do it.
So this month, Cherudo.
Yes.
So show your love.
Show your love.
By sending something small.
To
Star
255. Yes.
Okay. Hey, I see. And the response has been good.
Oh, fantastic. Fantastic. And there are some people, the moment they donate, they also will tell the next person that I have donated, so come and donate. You understand me? And then the last time Eric AJ, CEO of the NEIP, came, made his donation, and then called out the GRE boss. This morning, the GRE boss called me and said, are you in the office? I'm coming to make... Yes. So every now and then it gets exciting. When we were at our board retreat this weekend, the board members were eager. Everybody was pushing their money into the box. So it just cuts across. Everybody has a lot of... The moment is about health. You see that people simply... Yes. You get those who simply think that, oh, I'm not going to go and give money to that one. No, you know, there are people who are petty like that. Simply think that, oh, it's because Obuobia is heading this institution, my money is not going there, or my corporate institution's money is not going there. But they have, those people don't really count. The ones that are really interested are many. You understand me? And that's where we should focus on. But I'm saying that for corporate institutions, especially in Accra, if we decide that, listen, we are coming together to retool the Ridge Hospital, that is an impact.
Okay.
And that's exactly what we are doing. We're talking to corporate institutions to help us retool Ridge Hospital and use it as a pet project.
Okay.
You understand me? The year just began. Many of them have their CSR budgets in place and all. We are asking that the little you can take out of it for us, or even just call us and tell us, like, I just want to buy a mammogram machine for Ridge Hospital. Just partner with us, because when you finish buying those equipment, we will take care of the equipment for you. People are simply fed up with donating equipment to the hospitals because they simply think that it's not taking good care of.
Yes.
And they think that, oh, you come, you install it for them, and 3, 4, 5 years is down, and then they are always looking for new equipment and all. No, with the Ghana Medical Trust Fund, it's different. When you partner us to buy these equipments for these facilities, the facilities do not have any power over those equipment. We take care of it. We
manage it yourself?
Yes, we will manage it ourselves. We know when the servicing date is. We know what time the equipment replacement is and all. So we take care of those equipments, and It's not the facilities who take
Be
care of
responsible
it.
for
So
them.
now you can simply say, oh, no, we are tired. We've done it before. No, this time it has changed because there's a Ghana Medical Trust Fund.
So I'm guessing you've had many of these conversations with people.
Yes,
and these concerns keep coming up.
Yes, and a lot of them simply have given up on spending their CSRs on medical equipment because they think that the last time we took this here and within 3 years it was done. They don't take good care of it, and we keep hearing those conversations.
Do your assurances help in any way?
Yes, and I think that many people this year, and I'm telling you, I'm sure we'll come back to have this conversation, corporate institutions for their CSRs this year will contribute to the Ghana Medical Trust Fund.
Oh, that's great.
Yes, because they simply think that now we are here, we are not just dumping the equipment in the facilities, we are promising to take care of them. Because if you sit back and say that you are not helping at all, let me tell you, for the 50 regional hospitals that we did the needs assessment of the whole country, only 5 hospitals have a functional mammogram machine.
5 mammograms?
Yes.
In 15?
Out of the 15 that we did earlier on, and then my guys went out last week to do the other 6. So, we are dealing with 21.
21,
Yes,
okay.
but we've done the 15. Of the 15, we have 5 mammogram machines which are functional.
5 functional mammogram machines?
In the regional hospitals and in the teaching hospitals. Yes. You have only 2 hospitals with MRI.
2 out of 15?
Yes,
that
MRI.
You did.
So when you wake up in the morning, let's say in Damango, and then you have a condition that the doctor says, listen, before I can get clarity, get an MRI done. You have to either come to Kolebu or go to a private facility in Accra. So for that patient, if you are under the Ghana Medical Trust Fund and we do not put an equipment around that catchment area, that means that we need to take you, a helper of yours, bring all of you down to Accra or whichever facility, private facility in Accra, for you to run that test. Not thinking about accommodation, thinking about how to take care of the person who is going to help you to come down to Accra, transportation and all that. We cannot work like that. And that's why we say that by the time we are rolling out into our first phase, when we roll out, we should be able to put like an MRI at Tamale Teaching Hospital. So that all those in the surrounding communities, constituencies, and everywhere can go to the Tamale Teaching Hospital to get an MRI done. So that you don't have to come all the way to Accra. Okay. So that when you come into the middle belt, there's Sunyani, there's Ho, there's Konfanochi. You understand me? So it's important that we put some critical equipment in these facilities so that it will help ease the load on us and even save us some money. Because ordinarily, we will have to transport more people to Accra. I'm sure that you have heard about catheterization centers we are putting up in the various regions.
Yes.
We started with 3. So we are putting one in Tamale Teaching Hospital, one in Konfanochi Teaching Hospital, and then replacing the Kolebu one that got burnt earlier on.
Yes,
I
the
told
one
you
you
about that.
Yes.
What these catheterization labs does is that it doesn't allow for open brain surgeries. Yeah. So if you have one in Accra, if Kolebu is changed and comes up by March ending, you have one in Konfanochi, it will take care of Western, North, all that those areas in the middle belt. And then you have one in Tamale, so those coming from Savannah, all those areas can access it. That's a game changer. And these facilities have ICUs, they have the wards, they have consulting rooms, they have the oxygen plants, they have even a pharmacy in there. So it's a whole new building that we are putting up in Konfanochi and in Tamale in collaboration with the Ministry of Health. So that situation that happened to the nurse, the midwife that we took care of at Irake, if it happens to somebody in the Savannah region, that person can go to Tamale Teaching Hospital and get it sorted. And we're not only putting up those equipment and infrastructure, what we are doing also is training the staff who will operate those equipment. So taking the doctors and the nurses and all that will operate that facility up for training.
Okay.
For that factory that is giving us the equipment, we also negotiated for a training element.
Okay.
So all these health workers will go for training before the equipment arrives.
Okay.
So that the moment they come back from the training, that equipment is up and they can start.
They know what to do with.
So I think that that's our first intervention as a trust fund, the catheterization labs.
Okay.
And I am excited about it already because just looking at what happened with this midwife that we had to take care of, I know that if we have these equipments across the country, it can save a lot of life. Can you imagine when you go for an open head surgery, even how long it will take you to recover? When the nurse was operated upon at the Eurocare, within 3 days, she was on her way home.
Oh, really?
Yes, because
of the catheterization?
Exactly. And I'm sure that if you have the video, when you go to our YouTube, you see the videos there. Simple.
No, I saw the video on Facebook.
Yeah.
It was impressive. Was in most of the newspapers.
She had the surgery. That day I was there. The next day she was still there. The third day we went when she was being discharged.
Oh, that was 3 days after.
3 days.
How? Because really?
And for such an equipment, the only place that they have is Kolebu when it comes to the government facilities. And then Eurocare just put one in their facility. So now, if you don't get access in Kolebu, because Kolebu has been down for a while, everybody's heading to Eurocare. And it cost us $210,000 to pay for the nurse, just for her to get back on her feet.
That's because you're looking at when so you did the needs assessment, the equipment gaps alone. So what are you doing about? Because now you have to do a mammogram for many of the places, a CT scan, MRI. I'm assuming.
Yes.
Do you intend to put all this up before the rollout, or what's the plan?
What we intend to, there's some list that we have, we call the urgent needs.
Okay.
Yes, that's what we're working on now.
Okay.
If we're able to put some in Tamale Teaching Hospital, bring down some to Comfort Noche, think about between Hohoi and Ho, think about Tefian Kwanta, that will take care of Western North and its surroundings. Think about Ridge Hospital. Then at least we know that some of these areas have these critical equipment and can take care of our patients. So we intend to do that by the time we are rolling out, or even a few months after. You understand me? So that we will be able to bridge the equipment gap. We can't say that we will do it immediately, but then we do the urgent ones, and then as we move on, we keep adding. Okay.
What about, have you also done a needs assessment on the specialist? Because one of the things we talk about is the training that you have to do.
We have. And then even for some of these facilities, you can even put the equipment there, but then the specialist will not be there.
Okay.
So that's what comes to mind when I talk about the training of the specialists.
Okay.
In some few days, you see us sign a contract with the Physicians and Surgeons College.
Okay.
They are about training oncologists, nephrologists, and other specialist care doctors for us.
Okay.
You understand me? His Excellency the President simply wants every region to boast of about 10 specialists by the time we roll out and going forward. That every region will boast of some of these specialists, because they will be the specialists that will take care of the chronic diseases that we're taking care of. You can simply not be able to treat cancers when you don't have an oncologist on site. How are you going to do that? Nephrologists for the cardio and all these specialists. You simply need specialists for them. So when we do that with the Physicians and Surgeons College, we will also train 100 specialist nurses. We're doing that with the Midwives and Nurses College also.
Okay.
Then we have spoken to the Pharmacists College also. They will also train about 100 for us. So as soon as we are done with the Physicians and Surgeons, all those contracts will also be signed, and then payment will be made, so that we know that all these people are going through training for us. And let me remind you, these trainings take about 3 years.
Wow.
Yes. So basically, we will fall back on those who are in the system already. Maybe what we can do is to do like a rotational table, so that you know that maybe for Tamale Teaching Hospital on Thursdays, or maybe Thursday and Fridays, these specialists, we take them there to work on such cases for us. So they go on the ticket of the Ghana Medical Trust Fund. So we know that in whole, they know that on Wednesdays, these specialists will come in. So they pile the cases for them, and then maybe a day or two, they just go get it done and come back. So it's a conversation that we are having, and I'm sure that very soon it will all come together, and the foundation will be built solidly.
In terms of the things you need to do before the rollout, your to-do list,
Yeah.
how far are you?
Oh, I think that the major one is our software.
Okay.
And I think that we're on course.
Okay.
When it comes to the training of the specialists, the conversations have been held. The board just approved it. So the nurses and all training. What we haven't touched so far, and I'm not sure we will touch anytime soon, is the research bit of it. Because then we have to roll out, get the specialists on board, and all the infrastructure and equipment and all coming into place. Then I'm sure we can also think about the research. So if you ask me, for the first April rollout, we're on course.
You're sure you'll be able to roll out by 1st April?
Oh, straight.
Yeah.
That's why I'm so sure.
But in the meantime, how are you then dealing with? Because the big issue now will be the matter of people understanding exactly what you're supposed to do.
That's why we are here this morning.
Where you are.
That's why we are here.
But do you get lots of people? Do you have pressure on you currently from people who think that money is there? Bring the money.
Oh, of course. But we keep explaining. And I think last week we had done one of the Akan stations, and it was fantastic. Many people, if you listen to the messages that came, many people simply thought that, is this what it's about? We didn't know. You understand me? So it's important that we do like a lot of media engagement and get people educated on what this mandate is about and what the Act really says. So that's exactly what we are doing. And I think that the whole week, that's what
you'll be doing.
Yes. It's
That's
important that we educate the people of Ghana on what the mandate is about.
And then there's someone who says I should ask you about the limits, parameters. Do you have any limits in terms of what you are supposed to do? Maybe even with diseases, what you can do to help the person? How far you can go?
Yes, and that's why our team also went out to do the costing. They've gone to the hospitals. They are doing the costing. They are dealing with the consultant who work all that, so that we know that we can come to a middle ground on exactly what the cost will be and all that. So I'm sure that eventually all those will come out after the costing is done, because we even have to have a technical committee with the National Health Insurance, so that we know exactly where they end, how we take over, and when we take over, what the load will be. So all those are in place. By the time we roll out, all those will be clearer.
Let me go through some of the messages, because I think this has a lot to do with the people who are listening to us. Let me see if I can find some of the questions, because there were some that came in earlier. People asking, because Elulu Mensah, for example, was saying that education on this, his initial education on this is very poor. But it looks like that's why you step out. You decided to step out over this period, educate people on what you've been doing. Then also, Senator, this attack must, I think this is about what we're discussing earlier. A few more comments from a lot of it is about people saying, okay, so Alhaji Baba Umar, may God, the good Lord bless, guide, and continue to protect you for your love for humanity. There's Comfort Chua, is it Chua Fianuku? I have to look at that name again. Says the best MD, my mentor. There's Berasimu says productive day, productive woman always on top of her job. There's Fozia Zila Seidu says Mama Care is here to stay, no doubt. And I'll come back on that issue of here to stay. And there's Mamaga Aku Dagadu who says will be the pace setter. Go, mommy. There's Kobla who says, can you please? Okay, thank you. All right. So most of the comment, but I wanted to find out from you. When it was initially proposed, one of the fears that people had was this could be something that comes with President Mahama and perhaps vanishes after he's gone. Because somebody may decide, no, I don't want to continue in this direction because I disagree with it. In terms of cross-party, the conversations that have been had, do you get the impression that there's reservations?
I'm not sure why anybody will have reservations when there's an intervention for healthcare. Because it cannot be politics as usual. Many people simply think that maybe because they call it Mahama Cares and then clearly you'll go home with Mahama. But Mahama Cares is not the name of the fund. You understand me? The name of the fund is the Ghana Medical Trust Fund. Mahama Cares is like when you were in school and you had a nickname. Tell me about your nickname.
So the nickname is Mahama Care.
That's it. So anybody who simply thinks, oh, because they call it Mahama Care, so it won't last, it's not yet. It cannot be a joke. When you are diagnosed with a cancer and you get a fund that is virtually paying the bills, taking care of your diagnosis, your treatment and all. So another government comes and says that, listen, because it is called Mahama Care, so I've cancelled it. That will not be a serious government. When we started the National Health Insurance, you know the conversations that went on with it. But it's here to stay and it's lived the test of time. And I believe that the Ghana Medical Trust Fund will also stand the test of time. So I take this one as some of the teething issues, problems that we will have clearly. It's for us to tell the story, let the people of Ghana know what this intervention will do to the next person. It might not be you. It might be your father, your mother, your sister, your aunt, somebody you even love out there who will get into that situation, and that intervention will be that life-saving moment for that person. For this nurse who loves what she does, going midwife who goes, takes care of her pregnant women, delivers their children, excited about it. Just one day in line of duty, that thing went off in her head and she didn't know what to do next. If we had not come and made that intervention for her, where would she be by now? So for such a person, do you think that she would sit and think that Ghana Medical Trust Fund ends with Mahama? Because it has saved her life. And she knows that it has the capabilities of saving the next person. So it's not about what you think today because you are not an NDC member or a patriotic Ghanaian. It must not be politics as usual. We have to think beyond the politics. Healthcare is one that we can simply not toy with.
And then in terms of things to do, I'm also thinking, have you done some projections on how much you need in order to be able to perhaps deal with the equipment gaps? For example, within which period you have in mind to do with all this?
No, so what we intend to do is to do it in phases.
Okay.
And then because corporate Ghana is also coming in stronger to help us, we want to know, maybe for Ridge Hospital, we are not putting the money from the fund into it. But then we're getting corporate institutions to partner us to retool Ridge. We know that maybe for Tamale, for Hohoi, for Ifian Kwanta, if we need to put an MRI there because it's part of an urgent need, then maybe that one we need to take some money from the trust fund to put it there because there are urgent needs that will help our rollout.
Okay.
But then going forward, we think that a lot of these equipment gaps will be filled by corporate Ghana, funds, and all the other people who simply want to come in and help our healthcare facilities. You understand? But because these ones are urgent, that one we need to deal with it because they are pressing, so that it does not add to the cost of us transporting patients into Accra and Kumasi and all that. But then I'm sure that after we've done that first phase, going forward, it will become clearer on how we can make such interventions.
And you're sure to put all this in place before the rollout?
Of course. We are working very hard. We are not sleeping.
But you don't have a needs assessment.
Yes, we finished with the 15 earlier on. The team went back to do the 6 because there are some of the districts that simply do not have the teaching hospitals or the regional hospitals. So for them, we have to deal with just some of the district hospitals. So those are the 6 that we are adding to it. So the team led by Dr. Nobe Kipo went around last week to get that one also done. So we will add it to what we already have so that we can have a working document.
And I'll read this to you so that perhaps there's someone who sent me this. Says, I had a motor accident when returning from work at Sege. Now I'm diagnosed with CIDP, that's chronic inflammatory. The other one, I'm not so sure I can go through them, but it said the Trust Hospital wrote to your office to support me in buying human immunoglobulin vaccine. I'm now on second line treatment, so the letter is in her office. For someone like this, what happens?
So Dr. Nobekipo will look at this doctor's letter.
Okay.
And then access it if it qualifies to be part of the 50 pilot cases.
Okay.
That we are doing now.
Okay.
If it doesn't, then that person has to wait till we roll out from the 1st of April.
Okay.
And then even as we roll out, we are not rolling out with all conditions immediately.
Okay.
What we're doing is that for the conditions also, we are rolling out in phases.
Okay.
So for now, we are so clear that we are rolling out with the cancers. Because the cancers are becoming a problem for the country.
Cancers?
So for childhood cancers,
okay.
Prostate, the breast, cervical, and kidney, the cancers. So what we intend to do is to roll out the cancers. Then as we go on, maybe quarterly or every 6 months, we add.
Okay.
Yes. So clearly by the end of the year, you will see more conditions. But as we roll out from the 1st of April, we want to start with the cancers.
Well, when they started, everybody was wondering, health. Well, you were not you have. Did you do anything in health aside the
no, zero?
So the questions we're asking on radio aside those
zero,
ones.
That's all.
That was. So I'm guessing. What have you learned over this period about our healthcare system?
A lot, and I simply want to give a lot of credit to my policy advisor, who is a doctor, Dr. Norbert Kipo. He came in handy.
Okay.
And he came in immediately. I got this green letter.
Okay.
And I think that is the best decision that I took to keep him around me. What he's done is that he fills in the gap for me. Where I do not go, he will go. And where I am handicapped,
he will show you up.
So I think that he's really been helpful to me because he understands the issues, the technical bit of it. There are some that he will say, Madam, no, this one we can do. This one will do it. And because of where he's coming from and his background, I respect his decisions, I respect his advice and everything. And I think that that's what has been helpful to us. So it's not as if I'm the boss and what I say is final. No. he is coming from the industry. He understands what is done there, how it's operated and all. So we have worked together beautifully. And I think that when I come and sit here and begin to talk about it as if that I joined them in medical school, it's because of what he has done so far as we have been together. So I want to give him credit for how far we have come. And I know that we are building this foundation and we will do it well.
You have had to learn a lot
on the job.
Short period of
and
time.
there were many people who simply were thinking that, what's the point? Why are you putting this girl there? Especially because she doesn't have any medical background or anything about health policy and all that. But I pray that I haven't disappointed so far.
Okay, so let me, I don't know, but I usually don't do this, but if you don't mind, maybe I can pick some 5 calls. If you have some questions,
let's go on.
if you have some questions to ask,
sure.
please feel free. Call in 030.
I cannot come and sit here and not take calls. When I used to take, I used to 3034913.
So join us. If you have any questions to ask that you feel that I haven't asked, that she has not addressed on this matter, kindly join us. A few things to note if you're just joining us is that currently they are doing a pilot. The rollout will start from 1st April. Yes. Even the rollout will not be everything at once. It will be a gradual rollout in phases. So, okay, we've lost the very first caller. So we'll pick a few calls on this. If you have any questions to ask, any issues to raise about the work they are doing, because of course this thing affects virtually everybody. It's not cheap to manage something like kidney failure. Dialysis is a very expensive bit. If you have had to do surgery, it's not cheap. So this is what it's supposed to do. Help us deal with. Good morning.
Good morning. My bro. How are you doing?
I guess this is Eben.
Yes, this is Eben.
Okay, so Eben, what issue do you have to raise?
I want to applaud her because when you talk about Mahama'S and as she said, the name wasn't Mahama, but just a nickname. Because I remember last time, micro minority leader criticizing the name. So for me, when I heard her saying the name wasn't Mahama'S, but it's a nickname, but it was founding something, I was so happy. And I believe that this Mahama'S really would support people, and even if government change, it will not be taken. Because I'm saying this because here in my constituency, a lady came to me that the mother also is having Sanka and he wants to use Mahama'S to visit. I told her to go to the MP's office, submit a document, then it will start from there. So I appreciate them much for the yeoman job doing when it comes to Mahama'S. Kudos, Madam Obuobia.
Thank you very much.
Okay, so for someone like that, because he is now directing the person to your office, you say you do not deal with the patients.
That's what I'm saying. When we come to the rollout bit of it from the 1st of April, you cannot direct your medical issues to us directly.
Okay.
Your doctor has to make that intervention for you. So have that conversation with your doctor, and then he will onboard you.
So 0302 300 281. We have another caller. Good morning.
Hello.
Yes.
Yeah. Good morning, sir.
Yes, your name and where you're calling us from?
Yeah, I'm calling from Medina Atomic Junction.
Okay, Medina Atomic Junction, your name?
Yeah, my name is Africanus.
Okay, so what's the issue you have to raise?
Yeah, I'm on treatment at Kolebu for prostate cancer, and the machine appears to be overused, so it keeps breaking down regularly. What are they doing about it so that those of us who are on treatment will be able to continue?
Thank you.
That's radiotherapy machine, right?
Yes, please.
So far, the whole country has 1.5.
1.5?
Half in Kolebu, because the Kolebu one keeps breaking down and the other one is in a private facility. Yes. But what we are doing is that I'm hoping that by the end of the month, there's this company that is coming on board. They want to build an oncology center in Kolebu, Konfanoche, and Tamale.
Okay.
And then that facility will have everything for the treatment of cancer.
Okay.
So I am hoping that we will be able to put that up, and then for the cancer patients who are on treatment, especially in Kolebu, the story will change. I'm not saying that it will change immediately, but then I'm sure that latest between a year and a half, I'm sure they will have some respite, because it's a complaints that keeps coming all the time. Sometimes the machine is down for months and they are not able to get their treatment, and it's a headache for all of us. And then those who have to access the private one, it's not cheap. Most of them cannot afford it. So we are looking at ways in bridging that gap, and I'm sure that very soon some good news will come on.
We have another caller on the line. Good morning.
Good morning, sir.
Michael.
Yes, sir.
Okay, so Michael, what's your issue?
My issue is last year, me brother, you did not do dialysis, but the same machine I say, and I'm a new soon to me brother with primo last year. Then now, Muya found there, 8 years, a benya spare machine, a benya 2 or 3. Then a Muya found.
Which hospital?
Kolebu.
Oh, okay.
Yes.
I would be surprised if Kolebu just has one dialysis machines. I'm not sure it's dialysis. It maybe it's another equipment, because when it comes to dialysis centers, I think Kolebu has the best one now. They even have a new one with a lot of machines. So
okay.
it depends on what kind of treatment. So maybe it's not the dialysis one, but something else. Yes.
So as far as you know, the dialysis unit at Kolebu does not.
There's no problem with that. They even have a new one that operates like fully. Okay.
So, hey, but that's interesting. So at this point in time, I guess I can mention a hospital and you tell me, because I'm listening to, I'm wondering. So if I mention a hospital right now, you'll be able to tell me what they don't have or what they have. Anyway, we have a caller here. Good morning. Hello, good morning. Hello, good morning. Hello, can you hear me? Hello?
Hello?
Yes, I can hear you. Can you hear me? Can you hear me? No, I don't think.
No.
Oh, but you can hear me enough to say no. So if you can hear me, please go ahead. Tell us what. Oh, we've lost him. He could hear me enough to say no, but he says he can't hear me. So I was hoping that even if he was listening via radio, you could just go ahead and tell us. So if you can't hear me and you can hear yourself on radio in the background, just say what your issue is. We'll listen. Good morning.
Good morning, Hosanna.
Yes, can you hear me?
Hello.
Yes. I can hear you clearly. Your name and where you're calling us from?
My name is Richard, calling from Banana Mangoda.
Okay. So, for Richard, we are listening to you. What's your issue?
Good morning to Madam Obuobia.
Good morning, sir.
Yes, and I have a program about this. Is it FNR test? The last time I was sick, they directed me to Bank of Ghana Hospital. When I went there, they said machine is very low or down, so we couldn't do it. So they also directed to Accra Medical at Obuobia. When we went there, I did the test. At the costing of the price is too much for us. So what are they doing about it? I went to police hospital. They don't have the machine over there. And calling me to, I don't know what to go. So please, if you can do something about it.
Which machine is that?
Which is it, MRI or?
Yes, MRI.
Okay.
Yeah.
So the cost.
Yeah, when you go to the private facilities, it's very expensive.
1,500.
Yes, Accra Medical.
No, but he's saying Accra Medical.
Yes, but Accra Medical Center is a private facility.
Okay. The other one, yes.
So ordinarily, if Kolebu does not have it and Ridge Hospital doesn't have it at all,
no MRI.
Kolebu
still
has one, but I think that there's the load on it is quite. Then the queue, especially, there are some that can queue for almost about a month to 2 months, yes, before they could get But and then all the others are in private facilities and they are very expensive. So for that one, we cannot subsidize it for you. So then that means you have to go and join the queue in Kolebu So it's part of the urgent needs that we talk about, so that if we decide to retool, it's important to add one more and maybe a bigger one to Kolebu and then put one in Ridge Hospital.
Okay.
So that at least, because if it's in these facilities, you will not pay 1,500 for it. I think it's about 500 or so. I don't want to guess, but that's what it is. Because you have to access the private facilities for it, they will charge you more than
higher.
what you can get in Kolebu or Ridge Hospital.
Well, let's speak. Hello?
Hello, good morning.
Yes. You're the man where calling us from?
My name is Emmanuel. I'm calling from Chado.
Okay, Emmanuel from Chado.
Congratulate Senna for an excellent interview, as well as congratulate Madam for losing a parliamentary seat, because she's more effective here than she would have been. That's by the way. Madam, do you have any plans to complement your system with traditional medicine so that we can develop that alongside? Thank you.
No, thank you. Is that also
I think there is a conversation that is coming up strongly. But what it is that because of the load of trying to roll out, I'm sure that as we finish rolling out, we can start bringing them also in and having that conversation and see how we can fit them in. I have had a lot of comments about it, traditional medicine, and also I think that it's a conversation that we will have very soon.
Well, so I think we can leave it there. And let me say a big thank you to you.
You don't want to take a last caller?
Okay. I don't have a last.
Okay, then you're good.
But nowadays, everybody's doing social media. I've realized that you're doing a lot on social media. Which pages are you on? Which platforms do you use, Karen?
We do Facebook, we do Instagram, we on YouTube. This is a media advisor, Mr. Eric Boati.
Okay, so Facebook, Instagram, YouTube.
We do more of YouTube. We're on X. Yes.
Okay. So is Ghana Medical Trust Fund?
Ghana Medical Trust Fund. Okay. Anywhere you hear Mahama'S, somebody wants to mention the nickname. Or somebody wants to be mischievous and just simply say, hey, Mahama, dear. Won't say, and that's all they keep saying. But I'm telling you, if a family member of yours is able to access it and get his or her life saved, you will not talk down on the Ghana Medical Trust Fund ever.
Okay. On YouTube, I understand it's GMTV. Okay, GMFTTV.
So Ghana Medical Trust Fund TV.
Okay. GMTF. GMTF TV. GMTF TV. So you can monitor everything they are doing. Every step they take.
And sometimes some of these patients are able to give us their consent, and then the hospitals also give us their consent. We're able to enter into theaters and stuff, take footages of what kind of treatment is being given to our patients, and then we put all of it out there in our documentaries and all, so that people will know exactly what we have started doing.
Let's start from what you said from the beginning. You said when you took the letter, you were a happy girl. So far, is the happiness still there?
I'm excited already.
Oh, okay. All the things.
The happiness has turned into excitement.
So all the things you're saying have not dampened your spirit.
No, at all. Even wants me. Even like urges me on. I want to do more, because I know that is a foundation that I am building. And if the foundation is solid, the building will be so beautiful.
Well, your friends, this is Mr. Andolfo who says, Senna, please, good morning to my mommy for me. She's a wonderful person. I guess she is the one who drives your friend, Madam Joyce Boa Mukhtari. And there's some more messages. Senna, please, I want to know whether the GMTF operations are limited to only big cities and towns. Will they extend it to the districts?
No,
so everybody.
You see, let me tell you something. The primary health care is dealing with the CHIPS compound and the various little midwives and all that. National Health Insurance deals more with the district hospitals, the polyclinics, and all. The moment you exhaust all that, then you come up into the regional hospitals and the teaching hospitals, and that's when we take over.
Okay.
So basically, when you are referred to the regional hospital, you can access us. When you are referred to the teaching hospitals, you can access us. And then the private hospitals that we will eventually put out as being part of us, you can also access us from there.
I don't want people to be fighting me after I'm done with you. So let me go through these messages that they are sending. This is from Abna Ampofowa. It says, please tell my mother that may God continue to grant you wisdom, strength, and grace as you carry this responsibility. Ghana is blessed to have you. Keep shining, keep leading, keep making a difference. I'm watching the program, and this is also... this is Alidu Mohammed, who says Madam Obuobia is doing a wonderful job for Ghana at Ghana Medical Trust Fund. God bless you. There's this one says, please extend my greetings to the most effective administrator of Mahama'S. This is Idana Osman watching, following the discussion from Tamale. There's also Justice Akpabli, who says, listening to my mother and the first and result-oriented administrator, Obuobia Darko, Opoku's voice is such a massive flex. Some of us knew she would do very well as the first administrator of Ghana Medical Trust Fund, and she's doing just that. We are super proud of her. God bless her for intervening for many people who needed help for the surgeries or treatment through the Medical Trust Fund. We are proud of her. Two questions one on mentoring, which you've been doing for many years now, and then the other one also on, first, let me start with the legacy, because you are first administrator, Ghana Medical Trust Fund. Many years after, maybe you are not still sitting in that chair. What would make you proud? What would be your what legacy would you like to leave?
That's what I keep talking about, the foundation. When the foundation is solid and the building is built and well decorated and everything, when you are moving in, all you do is you move in with your clothes and your shoes and your children to just go and live in that house. That's exactly what I want to leave for whoever comes after me.
Yeah, the person who
You
walks
just
in.
move in and come and sit down and do your work. All the T's will be crossed, all the I's will be dotted.
Yeah. Are you still doing Ignite?
Ignite is me.
Because I was wondering, looking at that, because every time I see you, social media, you are interested. Wow, this work is... We should still be able to do the mentoring.
I do it all the time. I do it. I have some of the one-on-one with the ladies in my free time, weekends and all. I do it. I cannot stop Ignite because it is my gift to the next generation. I cannot deprive them of the kind of impact that Ignite has on them. And it's what I didn't get as a young girl growing up. I simply think that the next generation needs it, and it's my duty to be able to impact them in a positive way.
How long have you been doing it now?
I think Ignite was 5 years old this January.
5
Yes.
January.
Yes.
And so far, are you seeing the results for which?
Fantastic. We started with 3 girls. This year, as we met for our 5th anniversary, Ignite is boasting of 480 young ladies.
480?
That celebration alone just did something else to us. As at this morning, I'm sure that when you come onto our WhatsApp pages, we're 700 plus. So I think that Ignite is here to stay.
And they will get your personal touch, because I realize that when you're doing something, you want everybody to feel...
Yes, they do all the time. And I wish I could do more, but they know that I also have to give my best to what His Excellency the President has asked me to do. So the little time I have, I share with them.
Well, let me conclude then by asking you, how does anyone outside Ghana support the Mahama'S? This is Nicholas Laguda. He's not from Seoul. He's not in Seoul, South Korea. I don't know how he ended up there. He was in the UK the last time.
We've had those questions since last week.
Okay.
There's a pay platform that we are putting on our website. It's called the Paystack. Yes, so the website will come live this week, and then on the website you get the donate button, and then you can donate there, because most of those international donors, that is where they have to go and donate. But for the local people, the bank accounts numbers are out there, and then the ones who want to pay by Momo also do the *255#. But I think that most of the international donors should be able to access our website and then you can press the donate button on there.
And the website is gmtf.gov.gh.
gmtf.gov.gh.
Yes. You can use space tag. You can also use. You said there's a link there.
Yes, you just press the donate button and you are in there. Yes. There are some who want to pay monthly. There are some who want to do one-off. When you get there, it just gives you the options, and then you can just decide on which button to click.
Remember, you are a big part of what they are doing. Your donations are what will keep this going. It's important. So do share with Ghana Medical Trust Fund. Next time you think about making a donation on your birthday, one of the places you should look at.
The Ghana Medical Trust Fund. Don't look at me as a person. Look at the Ghana Medical Trust Fund.
Anyway, wish you all the best.
Thank you.
And it's a pleasure having you.
Thank you. And it's always good to be here. And I'm sure that you realize how emotional I am. Every single day when I enter this place, this is how I feel, because this is where I started. I started as a receptionist, went through to become a marketing executive, worked in the sales department, worked in the newsroom, worked as a Kanewu presenter, worked as a producer for the morning show. I produced James A. Jenimbuatin for so many years with Ambrose. We had the Liberian presenter also. Then eventually Suini came, and then one day Suini traveled out of the country because his father had passed on, sadly, and then I had to sit in for him. And then I became a morning show host for Fridays.
Okay.
And then I combined my newsroom work with it. So this is where it started for me, and I am who I am because of Radio Gold. So it's something that I don't take for granted at all, and I keep reminding myself that wherever I am, Radio Gold should be remembered.
Thank you. So she's no guest here, like I said. The reference to guest is only because of the modality of the show. There has to be a host and there has to be a guest. So that's what made her a guest on the show this morning. But at Radio Gold, she's at home. Well,
I'm surprised that Eric Boatin didn't get us any wache to eat on the bonnet, because in the mornings with Kwame Sefakai, all of them, when we started, we used to eat our waches on the car bonnet.
Yeah,
he's forgotten the tradition.
No, they messed up with the tradition. The tradition does not continue. Anyway, she's Obuobia Darko Opoku. Everybody knows her as Obi. And she's now administrator of the Ghana Medical Trust Fund. Needs a lot of help. Please don't hear the money you have heard and start shouting. It won't do it. That won't
the
go
money
far.
Is big. Oh.
No. It won't do as much as you think. There's a lot of work that needs to be done. And it's impressive listening to you, virtually knowing where every equipment is, who doesn't have that, who doesn't have those. We are back tomorrow with another edition of the Gold Morning Conversation. Up next is the Mid-Morning Show.